Hi, my name is Crystal Tyler, and today is Easter Sunday, and I am doing my video on mitral valve regurgitation, or also known as mitral insufficiency or mitral valve incompetency. There's many causes to this defect in the heart. Is it because we had rheumatic fever, which is caused by having strep too long? Did we have a heart attack? Do we have a mitral valve prolapse? Did we have a heart attack? Were we born with a congenital heart disease? Did we end up getting endocarditis? And that infection messing with the heart muscle and everything in the heart, did it actually go to the valve instead of the muscle? Have we had radiation or chemo, and that radiation to our chest mess with something going on in the heart? Have we had a prolapse of the mitral valve? There's many factors that could happen, or causes. Our age can cause it. Our diet can cause it. Are we not exercising enough? Some complications, if it's a mild, it does not necessarily going to affect us. But as the heart works harder as we age, or we get heavier, or our diet gets more strict, or the heart has damage to it due to a heart attack, it's going to be harder on that valve to get blood pumping for the rest of our body. So where this happens at is that we have to kind of know about the heart itself. So the blood flow of the heart, the comes through the superior vena cava and the inferior vena cava, and it drops right in here to the right atrium. It's going to go through the tricuspid valve into the right ventricle. From the right ventricle, it is going to go up through the pulmonary valve into the pulmonary arteries. Arteries and veins, there's two different things. So all veins go into the heart. All arteries leave the heart. The difference between the pulmonary vein and the pulmonary artery is that the pulmonary vein or artery leaves the heart is deoxygenated. That's the only artery that leaves the heart that is deoxygenated. Whereas the only vein that enters the heart is oxygenated is the left pulmonary veins. So they're going to come through and drop right into these pulmonary veins are going to drop into the right atrium. Well, they drop into, or to the left atrium, sorry. They come into the left atrium, and they're going to pass through the left atrium into the left ventricle by passing through the bicuspid valve, also known as the mitral valve. So what happens is these papilla muscles right here, they contract and pull down the valve so that it can open and close like it's supposed to. When it opens and closes like it's supposed to, all the blood's supposed to go out where it needs to. Well, when it doesn't do that, some of the blood stays on the top side of that valve. So when it stays on the top side of that valve, we're not getting all of the oxygen that we need for the rest of our body. And so as it worsens, like, we can have severe complications. Are we passing blood clots? Because that blood is going to eventually clot inside the heart. So we probably need to go on a blood thinner if our heart is weakening. Or do we need to go on like a Lasix or spironolactone to pull the fluid off of our body, because our heart is going to eventually, we're going to get too much fluid built up into our lower extremities where it normally goes. Are we short of breath? Do we need something going on there? Because we're not able to get oxygen to the rest of our body because our mitral valve is not working properly. So here is a top view of our heart. So here's our tricuspid valve. We got our aortic valve, we got our pulmonary valve, and we got our mitral or bicuspid valve. And this is the left side of the heart, this is the right side of the heart. So when it opens and closes, you literally, you'll have like a little bit of the blood that stays on top to the right atrium and not able to go into the left ventricle. Now, again, my name is Crystal. It's very nice to see you guys, and hope you learned a lot. Thanks.